In this presentation, we're going to talk about sports medicine ethics or ethics in athletic training. So first, what's the difference between ethics and values? Ethics are a set of rules that govern the behavior of a person established by a group or culture. So in athletic training, we have the NATA Code of Ethics, and we're going to talk about that a little bit later, and all athletic trainers should follow these. We also have values in athletic training, which we'll talk about too, but where values refer to the beliefs for which a person has enduring preference. So you prefer to do things a different way. So this is not a moral class. Just the purpose of this presentation is to provide some medical background on medical ethics and values that we use in athletic training. So there's a part of both of the values and ethics are benefits. This is doing good for our patients. Will the decision you make on behalf of your patient benefit their life? That's a big decision that we have to make. Each treatment option provides some benefit and some potentially negative outcomes for the patient. So we have to make those decisions with the patient in mind. We also have to be the patient's advocate because sometimes there's pressures from outside sources, a coach, a parent, other players. So it's our responsibility to be their advocate. We should never manipulate or coerce the patient to agree to a treatment that is against their values because each person has different values. So we'll just make sure that that's the benefits part of our ethics and our values. Is how we treat them. Are we going to be doing good for our patients? Non-malfeasance, again, do no harm again. Typically, you are considered avoiding harm at the time you are deciding to do good for your patient, but this is not always that clear. When deciding on a treatment option for a patient, you have to consider the patient's beliefs. If your treatment solutions violates the patient's beliefs, then providing that treatment is harming the patient. And so then we have a principle of double effect. The unintended medical consequences are acceptable as long as the intended consequences are legitimate and the harm is proportionally smaller than a benefit. So, for example, a student athlete sustains a ruptured spleen. Removal of that organ normally is not acceptable, but in this situation, it could result in saving the life of the patient. The removal of the spleen is therefore acceptable even without the patient's consent because the benefit greatly outweighs the harm. And we also have autonomy. The patient has the right to choose if she or he will follow your treatment suggestions based on their own set of morals and values. We may not agree with what they decide, but they have the autonomy to do this. Some examples for exceptions: when the patient is not competent enough to choose. I'll give an example of this. I am my dad's medical directive. He doesn't have the ability to make decisions on his own for his health. So I'm the one who has to stand in and make decisions for him to make sure that he is getting the care that we've talked about throughout his life about what he wants to do. This is especially for end-of-life type things. Because the person is intoxicated, confused, mentally incapable of making decisions, the patient must... the other one I would probably say is parents. Okay, the patient must provide consent for the treatment. There are cases where the patient can be represented by a legal proxy, like I was talking about with my dad. The patient education and informed consent are important components of patient autonomy. Don't assume that the patient wants the care that you want to provide them. You have to ask them. Confidentiality fits loosely under a patient's autonomy. I'm not going to have a hard time saying this word. I'm not going to say, you can read it on the screen. I'm not having a hard time saying that. Making decisions for a patient without seeking the input. So when can this be done? Does not preclude the healthcare provider from choosing to withhold a treatment that is being requested by a patient. For example, patient is requesting opioids for pain management. Sometimes that's not the best thing for them. This is avoided by making sure to always get the patient's informed consent. So some challenges to patient autonomy. Incompetence, the patient is deemed legally incapable of making rational decisions for themselves, often due to permanent conditions such as dementia. May have a legal surrogate appointment. That's kind of how I am with my dad, and I was like that with my mother too. Incapacity, patient is deemed clinically incapable of making rational decisions for themselves, may be due to a transient condition such as concussion, delirium, psychosis, or they're unconscious. Treat to self-other, usually a psychiatric setting. So these are some challenges to autonomy. In athletic training, this is going to be typically seen when we have a patient or an athlete who's knocked unconscious. We make an assumption that they want us to take care of them. That's assumed consent. We also want to speak truth to our patients, veracity, truth-telling, revealing all the pertinent details of a patient's condition to them, as well as the risk and benefits of the procedure and of their prognosis, if known. So you tell them everything you know about, the surgery or the rehab that you're going to do. And this includes telling the patients a mistake made during their care. Sometimes you do things wrong. Just own up to it. Patients can ask not to be told certain information also, and that has to be honored. Maybe they don't want to know the outcome that can possibly happen. Delay telling a patient their prognosis is okay to wait for a time when the patient is in a better position to receive the information unless they delay the informed consent. Again, this all goes back to patient values and what they want to know. It's just having a good relationship with your patients. One of the advantages I think we have in athletic training, most settings, is that hopefully we build that relationship with the student athlete or the athlete during the time. And so when we have some of these difficult decisions that the student or the athlete has to make, you have built trust with them. Veracity can be challenging in a situation where it is reasonably suspected that disclosure of the information would result in a patient engaging in self-harm. Again, it is never okay to lie or to deceive a patient for any reason. Question: is it ever appropriate to prioritize one patient over another? This is called distributive justice. Distribution of resources in a manner that is fair and just. It is not often equal distribution. For example, providing treatment first to a patient with life-threatening condition and delaying treatment to someone with a minor injury is being just, even if the person with the minor injury presented themselves first. This is in triage and first aid. If you have multiple injuries on a field, you have to take care of the person who's hurt worse before the person who's hurt less hurt. Not hurt as bad. Some patients may have conditions that require you to spend more time on their case as compared to with others. This time is not equal. So some challenges with this, think about this, is the care needed to get the starting quarterback cared for so that he can return to play, take priority over another athlete who is also injured, but less likely contribute as much to the overall success of a team. That's the real life conditions in athletics. Proportionality, overall, the benefits for the patient should outweigh the risk. So, always the good should outweigh the bad when we're taking care of our athletes, our patients. So, where do we find the guidelines for us in athletic training? We're going to talk about two documents: the Code of an NATA Code of Ethics. Now, I have a bunch of stuff on the following screens. I'm not going to read everything to you. I've provided this document in Canvas, the most recent Code of Ethics. So, our first principle in the role of an athletic trainer, members shall practice with compassion, respecting the rights, well-being, and dignity of others. And then you'll see that there are 3 points there, and I could address each one of those. So basically, we treat everybody compassionately, respecting their rights, and we treat everybody equally too. Principle 2, members shall comply with the laws and regulation governing the practice of athletic training, National Athletic Trainers Association membership standards, and the Code of Ethics. So we are held to these principles as an athletic trainer. We're going to follow the state laws and the NATA rules and regulations. Principle 3, members shall maintain and promote high standards in their provisions of service. So we're going to do the best job that we can. We stay current with our practice. And we're going to again, there's 6 points that you can read on your own. You should read these because you are held to these ethics. Principle 4, members shall not engage in conduct that could be construed as conflict of interest, reflects negatively on the NATA profession, the athletic training profession, or jeopardizes a patient's health and well-being. So you do things the right way. You don't harm our profession of athletic training the way that you work. Again, read those bullet points because you're held to this standard. Now, here on the same document is the athletic training shared of professional values. Again, I'm not going to read each one. I'm just going to go to the bullet points. Caring and compassion is an intense concern and desire to help improve the welfare of others. Integrity is a commitment that is internally motivated by the unyielding desire to do what is honest and right. Respect is the act of imparting genuine and unconditional appreciation and values for all persons. Competence is the ability to perform a task effectively with desirable outcomes. And accountability is the willingness to be responsible for answering to one's own actions. So again, these are the NATA Code of Ethics and the Athletic Training Shared Professional Values. This is what we as athletic trainers say that we are going to follow professionally. Then we also had the BOC Standards of Professional Practice, and these are broken up into 2 different areas: practice standards and code of professional responsibilities. So the BOC practice standards are to establish essential duties and obligations imposed by someone who's an ATC, by our credentialed ATC. Compliance with the practice standards are mandatory. The BOC does not express an opinion on competence or warrant job performance or credential holders. However, every athletic trainer and applicant must agree to apply with the practice standards at all times. So we are, again, expected to hold to these standards. I'm not going to read all these. Again, I've provided this document in Canvas. So we have 7 standards. We have direction, prevention, immediate care, examination, assessment, and diagnosis, therapeutic intervention, program discontinuation, and organization and administration. So those are our practice standards. Then we also have another code of professional practice. So the code mandates that us BOC credentialed ATC act professionally responsible in a professional responsible manner at all times. Okay, so these are, I'm gonna go over these, but I'm not gonna read. There's a bunch of bullet points, just like in our codes of ethics. So we have patient care responsibility. Athletic trainer has how we're supposed to provide patient care. Then competency. So basically, competency is being a lifelong learner and it complies and stay current with our BOC certification. Then we have more professional responsibilities, how we practice in our standards. Again, it says 18 bullet points. So again, you need to read all these things as you're held to these standards. Research. So we conduct research in an ethical way. We protect the human rights, and we do it to improve our practice. There's more than that, but that's the big ideal there. Social responsibility. We serve our profession and a community that benefits the society, and we advocate for health care, which we're doing in this class for a couple of our assignments. So we're being socially responsible, and we're telling others about our field and trying to be an advocate for health care. In our business practices, this basically means how we act when we are getting paid for our services. We don't deceive others in our way that we pay. We get paid for the way that we work. So we do everything ethically and correct. Again, there's more detail in that. So who does the NATA Code of Ethics apply to? It applies to any athletic trainer, anybody who is a certified athletic trainer or a member of the NATA. It also applies to the patients that we are providing care for. Who does the BOC standards and codes of professional practice apply to? Again, the same. Any member, anybody who is a certified athletic trainer through the BOC, and it applies to our patients. What role does the NATA and the BOC play in disciplinary actions? Now, this is an interesting thing as you read through some of these documents. If you see a fellow athletic trainer violating these things, there is a disciplinary action. It is your responsibility to report somebody who's in violation of this to the NATA and the BOC. And they can discipline anybody who is a member of the NATA or who is a certified athletic trainer. That's through the BOC. And they can actually remove them from membership, or that's the word I'm looking for, eliminate their certification. That's not the right word I'm looking for, but their person's an athletic trainer's certification can be taken away. So it's our responsibility if we see somebody and a fellow athletic trainer that is in violation to these standards and codes, to report them. And again, there's material, this is discussed in both those documents. Again, very important for you to read these documents because you are held to these standards as a practicing athletic trainer.